Hello, my name is Zion Park, and the drug I'll be doing is methamphetamine. So what is methamphetamine? Methamphetamine is a highly addictive and potent stimulant that affects both the central nervous system and the cardiovascular system. And here's a breakdown of its effects on the body. With long-term effects, there's things like brain damage. Prolonged use of methamphetamine can damage dopamine-producing neurons, leading to cognitive deficits, emotional regulation issues, and memory loss. You can also get mental health disorders. Chronic use can increase the risk of developing anxiety, paranoia, hallucinations, and violent behavior. In severe cases, you could develop methamphetamine-induced psychosis. There's also meth mouth, which is just causes dry mouth, leading to cavities, gum disease, and tooth decay. You can also get skin problems, which can lead to acne, sores, and skin picking, which can result in long-lasting scarring. There's also heart problems, which can lead to like arrhythmias, heart attacks, strokes, and due to its effects on the cardiovascular system, you get these things. With the immediate effects, you get euphoria, which is just a powerful feeling of intense pleasure or a rush. That is one of the primary reasons for its abuse. You get increased energy. People may feel extremely alert, talkative, and hyperactive. You get a heightened focus and concentration, which you just get an intense sense of mental clarity or ability to focus on tasks for an extended period. Your heart rate and blood pressure elevates extremely. Methamphetamine stimulates the central nervous system, which can result in faster heart rate and higher blood pressure. And lastly, just increased body temperature. A rise in temperature potentially leading to hyperthermia, which is very dangerous. So the risks. So obviously there's addiction, and the addiction you get is the intense rush it produces, which can lead to dependence where users feel they need the drug to feel normal. Over time, people may escalate their use to avoid the crash or come down after the drug's effects wear off. Also, the overdose, taking too much can lead to seizures, heart attacks, strokes, hyperthermia, respiratory failure, and even loss of conscious. So consequences. So for legal consequences, there's a thing classified as Schedule 2 controlled substance, meaning it is illegal to possess, distribute, or manufacture without a prescription. In the US, being caught with methamphetamine can lead to significant legal consequences, including imprisonment and fines. And then social and psychological consequences. Methamphetamine can harm personal relationships as users often become isolated or paranoid. Friends and family may become alienated as the user's behavior becomes erratic and unpredictable. And then long-term meth use can lead to significant emotional distress, including depression and anxiety, particularly when the effects of the drug begin to wear off. So mechanism. So meth increases the amount of dopamine in the brain, which is a neurotransmitter linked to pleasure and reward. This increase in dopamine is what creates the euphoric high. However, this is also what makes meth so addictive. The brain starts to crave that dopamine rush, leading to constant use. And the different ways you could do it is obviously smoking, there's snorting, which is with powder. There's also injecting, which I did not know about, and also swallowing with pills or even powder. So for the treatment, overcoming methamphetamine addiction is often requires a combination of medical and psychological interventions. While there are no FDA approved medications, sorry, to treat meth addiction, behavioral therapies, including cognitive behavioral therapy and contingency management, have been effective in treating addiction. And lastly, just prevention and awareness. Education and awareness campaigns aimed at informing individuals about the dangers of methamphetamine use have been crucial in reducing its prevalence. Prevention strategies focus on avoiding the onset of use, providing the treatment options for those struggling with addiction, and offering support networks for recovery. And here's my works cited. Thank you.